friends, welcome to Easy Nurse, where nursing education made easy. In this session, we will dive into the most important and expected topic of community health nursing that can definitely come in the upcoming exam of PBBSc second year. So here is the first question. So the first question is definition of PHC, principle and elements. So definition of PHC. So primary health care is essential health care made universally accessible to the individual and acceptable to them. So means primary health care center means primary health care we are giving, and it should be accessible and accessible to the each and every individual of the community, and through their full participation and at the cost that country and community can be afford. So primary healthcare services should be in such range that country and community people can be easily afford their services. So this is the definition of PHC. Next we will discuss the principles of PHC. So WHO expert committee has given the 5 principles of PHC. So first one is equitable distribution. Means each and every person in the community should get care from the PHC. Means primary health care should be accessible to each and every people without any discrimination to the people of community. Next one is a community involvement. So for successful completion of PHC care, primary health care, there must be a participation of the community. Without their interest, without their participation, primary health care or primary health center cannot work. Next one is a appropriate technology. So whatever the situation is there, according to the person need, we have to provide the appropriate technology and appropriate care according to the person, according to the people. Next one is a focus on prevention. So primary health center will be always focus on the preventive method. Means it will be go into the treatment thing, but primarily we have to focus on the prevention of the particular disease and particular disorder. Next one is a multi-sectorial approach. So PSC have to work with the other sector also. They have to work with the agriculture, education and social welfare. So there will be multi-sectorial approach will be there. Then only the PHC can be successfully work. Next we will discuss about the elements of PHC. So ELEMENTS. So this is the mnemonics how to remember the elements of PHC. So first one is a education for health. So PHC people, health worker will educate the people about their health. They will make sure the people are aware about the particular diseases and health problem that can occur into the community. Next element is locally endemic disease control. So whatever the disease is there, the infectious disease which is spreading in that particular area, so control of that infectious disease and control and prevention of that disease must be there done by PHC. Next one is an expanded program on immunization. So every child up to the 6th year of the age must have to complete their immunization. So that there are so many diseases which is preventable, such as the measles, mumps, rubella, pertussis, tetanus. So for this diseases, the children should get immunized. Next one is a maternal and child health and family planning. So maternal and child health is also important thing that PSC will deal with, and they will look into the family planning also. They will make aware about the people about the family planning. Next one is a environmental sanitation. So environmental sanitation, proper drainage system, safe water supply must be there in the particular area, and the things will be looked by the PHC. Next one is a nutrition and promotion of adequate food supply. So proper nutrition which is necessary by the community and the people in the community, so they should get the proper nutrition, and promotion of the adequate food supply must be there done by PHC. Next one is a treatment of the communicable diseases. So whatever the disease which is communicable, such as STD, AIDS, hepatitis B. So there were so many infectious diseases. So we have to focus on the treatment of the communicable diseases. And last one is a supply of the essential drugs. So there are so many essential drugs such as paracetamol, albendazole. So PSC must have the supply of this drugs to the people of community. So this is the definition of PHC, elements and principles. Next, we will discuss about the home visiting. So home visiting is a process of providing nursing care to the patient at their doorstep. So health worker will go to the community, to the people of the community, and they will provide care to the people of community to their doorstep. Next, the purpose of home visiting. First one is a prevention of diseases. So while home visiting, we will assess the condition of the people in the community, and according to that we will tell them various strategies, and we will spread the awareness in the community people so that they can easily prevent the communicable diseases. Next one is to carry out simple nursing care. So whatever the things are there according to the need of the patient, we will carry out simple nursing procedure, such as checking blood pressure or doing urine sample test. So like that simple things we will do. Next one is a promotion of the health. So by spreading awareness and making people educated about the disease and environmental aspect, we can promote the health of the people. Next, to assess the environmental hazards and give health education. So it's the responsibility of the health worker to assess the various situation of the community people and give them and educate them about the environmental hazards. Next one is to investigate the source of an infectious disease. From where the infectious disease is spreading, what is the cause of infectious disease, that the health worker will find out, and according to that treatment and prevention will be done. So this is the purpose of home visiting. Next, we will discuss the advantages of home visiting. So first advantage, it will provide the opportunity to study the home and family situation. So the health worker will go to the home and he will assess the condition of the family. He will see the general condition, environmental status, and the individual status will be assessed by the health worker. So it will help for the study of home and the family situation. Next one is home visit clarify the doubts raised by the family members. So whatever the doubts the family member are having, they can easily ask to the health worker and they can solve their problems. They can ask their doubts and misconception to the health worker so that it can get easily solved. Next one is home visiting provides an opportunity to maintain the continuity of family health care. So health worker or ASHA worker will be there who will conduct the home visiting on the regular basis, and it will help to provide the continuity of health care to the family. Next one is home visit provides opportunity to look for new problems. So whatever the new problem arising in the community or in the home or in the family, it can be easily assessed by the health worker. Next is a principle of home visiting. First one is a plan and purposeful. So home visiting must be planned by the health worker priorly, and there must be a purpose behind that for planning the home visiting. Next one is a based on the need of the people. So according to the need of the people, the home visiting must be planned by the health worker. Next one is a regular and flexible. So home visiting must be done by the health worker on the regular basis, and it should be flexible according to the family situation and family condition, and that is the third principle of home visiting, regular and flexible. It will help to build the rapport and interpersonal relationship with the family. Next one is a educative. So while doing home visiting, we can educate the people about simple things such as a personal hygiene, immunization, antenatal care, simple thing we can teach to the other peoples according to their needs, and it should be a educative. Next one is a convenient and acceptable. So whatever the things we are telling to the family, so it should be acceptable to them. So this is the next principle. And last one is a health problem. So while doing home visiting, the health worker have to assess the health problem and the family condition, whatever the health problem they are having, and according to that treatment and prevention can be done. Next one is a phases, steps, process, aspects, components of home visiting. So whatever the things is there, phases is there, step, process, or anything is there of home visiting, where you have to write this point. So first one is a initiation phase, second is a pre-visit phase, activities during home visiting, next one is a termination phase, and last one is a post-visit activities. So this is the phases of home visiting. So in the initiation phase, what will be done? So in the initiation phase, we will assess or we will find the purpose of home visiting. In the second phase, in the pre-visiting phase, we will see that how the family condition is, how many family members are there, cultural situation, or which area we are taking for home visiting. This thing will be discussed by the health worker. Next one is the activities during home visiting. So while we visit the home, we will introduce ourselves to the family, and we will try to build the rapport and interpersonal relationship with the family, and we will assess their condition, and if there is a need of care, so we will provide the care to the family and people of the family. Next one is a termination phase. So after achieving the goal, there will be termination phase, or if the family is changing their residential area, then there will be termination phase. And last one is a post-visit activity. So in this, we will record and report the process of home visiting, and whatever the findings we have got, we have to maintain the register for that. So this is the home visiting. Next, we will discuss that is Panchayat Raj. So this question can be definitely come for 5 marks. So it is very important for the exam point of view. So what is Panchayati Raj? So it is basically a local self-government in the state, and it is based on the 3-tiered structure. So that is known as a Panchayati Raj. So it is consist of the 3 levels. First one is a village level, second one is a block level where there will be Panchayat Samiti will be there. Next is a district level where Jilla Parishad will be there. So in the village level, there will be Gram Sabha, Gram Panchayat and Nyaya Panchayat. So Gram Sabha is the basic unit of Panchayati Raj, and it is a body of people, adult from the village. Next one is a Gram Panchayat. So Gram Panchayat is the executive organ of the Gram Sabha, and the people, like it is like 15 or 20 members will be there in the Gram Panchayat. Next one is a Nyaya Panchayat. So for 5 villages, there is one Nyaya Panchayat where the people of Nyaya Panchayat will be deal with the criminal offences and related to the civil things. Next, we will discuss about the block level. So in the block level, Panchayat Samiti will be there. So it is about 100 villages will be there, and population of about 80,000 to 1,20,000, and it provided with the Panchayat Samiti. So this in the block level, peoples of 80,000 or 1,20,000 people covered by the Panchayat Samiti, and it will be provided with the Sarpanch is there, and MLAs, MPs will be there, and the other block extension officer will be there, and they will work together here in the Panchayat Samiti at the block level. Next one is a district level, and where the Jilla Parishad will be there. So it is an instrument of local self-government at the district level is the Jilla Parishad. So in the Jilla Parishad, there will be people such as a collector, sarpanches will be there, block extension officer, MLAs, MP. So many people will be there, and they will look into the problem of the people. So this is all about the district level and Jilla Parishad. Next, we will discuss about the health education. So what is health education? So it is a combination of learning experiences designed to help individuals and communities to improve their health by increasing their knowledge and influencing their attitude. So what is health education? Health education is nothing but what learning experience that we are giving to the individual or to the people in the community, and because of that we will try to increase their knowledge and to improve their health. So this is the definition of health education. Next, we will discuss the principle of health education. So the first principle of health education is the interest. So interest in the people is very important, because we are giving health education and people of the community is not interested, then there is no matter of giving health education. So we have to improve, or we have to give such topic to the people so their interest will be facilitated and health education can be done successfully. Next one is a reinforcement. So some of the people are need some type of repetition, right? So repetition must be there in the health education, so that whatever the things, whatever the topic we are telling to the people, it should get fixed in their mind. Next one is the participation. So if the people of the community are actively participating, then there will be active learning will be takes place, or otherwise there will be passive learning will be there. So participation is very important, and it is a principle of health education. Next one is a comprehension. So according to the level of understanding of the people and according to their learning abilities, according to their knowledge, we have to give the health education to the people in the community. Next one is a good human relation. So the educator who is teaching, who is giving health education to the people of community, he should build or she should build the good relation, and she should try to build the rapport with the community people, so that process will be effective, that process will be successfully done. Next one is a communication. So communication is very important. The health educator must talk clearly and should solve the doubts of the people in the community. So communication is one of the important principle of the health health education. Next one is a learning by doing. So we have to make the people to learn the things by themselves and do the practice of these things. Means we will give the theoretical knowledge, but unless and until they will not practice, they will not learn the things, right? So we have to teach the people how to do things and how to do learning by doing. Next one is a motivation. So we have to motivate the people of the community that they should be get aware about themselves. They should get aware about the various disease condition, and motivation must be there in the people of community. So these are all the principles of the health education. Next is a school health program. So school health program is the vital component of the community health. The origin of the school health services in India is traced back in 1909 in the city of Baroda. So aims and objective. So comprehensive care for the health and well-being of all children include promoting positive health. So first aim of the school health program is to promote positive health. Means we have to promote the health of the people, health of the children who is going to the school. So promoting positive health is an important aspect and aim of the school health program. Next one is a preventive diseases. So there were so many diseases can affect the children. It can be anything, means can be a tetanus, diphtheria, pertussis. So we have to look to the child, we have to observe the child, and we have to give some important strategies that can help for the prevention of the diseases. Next point is early diagnosis, treatment and follow-up of health issues. Means early diagnosis, whatever the condition is in the child, we have to diagnose early, and according to the condition of the child, we have to do the treatment and follow-up of the health issue. Next one is raising the health awareness among the children. So we have to, through the school health program, we have to raise the awareness in the children that how to maintain simple things like personal hygiene we can teach them. So by teaching them a simple thing, by making them aware about the simple things, we can teach. Next one is the providing the healthy and supportive environment. So environment in the school must be supportive and encouraging to the student, and it should be healthy and supportive. Next one is a component. So first one is a regular medical checkup. So regular medical checkup means once the child get admission in the college or twice a year, there should be regular health checkup done by the school health nurse. Next one is a protection of all the school going children against the preventable disease. So there were so many diseases that can easily prevented by a simple vaccine. So that we have to prevent. Next one is a training of teacher. So school health nurse and other health worker give training to the teacher, like how to observe and how to assess the disease condition, or just send the children who is sick. So simple things we can teach, we can give training to the teachers. Next one is a health and population education program. So in this program we can include parents, teacher and children also, so that health can be promoted. Next one is the school health services. So there were so many services which is provided by the government of India under the various scheme, and that we will discuss one by one. So first one is the observation. So we have to observe the child. It is a responsibility of the school health nurse as well as the teacher to observe the child whether they are sick or whether they are having any problems. So this is the first point. Next one is a medical examination. So medical examination of the children must be done. Means from head to toe examination of the children is done by the school health nurse or by the teacher. Next one is the immunization. So it is the responsibility of the school health nurse and the teacher to assess the immunization status of the children. Means up to 6 years, the children's or the childhood period, that a baby has completed his immunization or not, that we have to check. Next one is a teachers training. So this is the also important services provided by school health services and program. And next one is a nutrition program. So in the childhood period we can see people are having more of the nutritious disease problem, such as a protein energy malnutrition we can say, and so many diseases are there, kwashiorkor, marasmus is there. So we have to prevent that diseases. So for that nutritional program or nutritional awareness must be given by teacher. So these are the some health services provided by the school health program. Next we will discuss ESIC scheme. That I can say definitely come for 5 marks. So we will discuss this. So the ESIC scheme means Employee State Insurance Act. In 1948 it is launched. So the ESIC Act passed in 1948 but abandoned in 1975, 1984 and 1989. So it is an important measure of social security and health insurance in this country. The act covers all the employees who are getting salary up to 15,000 per month and non-seasonal factories. So the people who are earning the salary up to the 15,000 or who are used to do a non-seasonal factories, the person who is working in the non-seasonal factories, so they can get the benefit of ESI scheme. They can comes under that ESI Act. So what benefits they can provide, we will see this. So the first one is a medical benefit. So if you are sick and you want a treatment from the ESI, so they will give you free of cost treatment. So if you are sick, you can apply to the ESI and you can easily get services from them. And if institutional care is needed to you, that specialized care can also provided by the ESI. Next one is a sickness benefit. So if the person or if the worker is sick and he is not able to do the work, he is not in that state, so at that time you will get the payment, you will get the cash money. So if you are ill up to the 91 days, so that government or that ESI scheme person will give you 50% of your salary. Next one is a maternity benefit. So in the maternity benefit, the lady can get 26 weeks of leave from the ESI scheme. Next one is a disablement benefit. So if the worker is working in the industry and he got injured or anything happened, occupational hazard is there. So if there is a temporary or permanent disablement is there, so that person can get cash or money from the ESI Act. Next one is a dependent benefit. So if the breadwinner of the family is died because of the occupational hazard, so dependent person, if wife is there or offspring is there, so they will get the dependent benefit. Next one is a funeral benefit. So ESI provide the funeral benefit up to the 10,000 to the worker who is having the insurance through the ESI Act. So next we will discuss the occupational health. So occupational health is a promotion and maintenance of the highest degree of physical, mental and social well-being of the worker in all occupation or total health of all at work. And this definition is given by WHO. Means in the occupational health, we will try to promote and maintain the health to the highest degree of physical, mental and social well-being of the all worker. We will try to maintain their health. We will try to promote their health, the people of the worker who is working in the industry. Next, occupational diseases. So there were so many occupational diseases, by them the occupational worker can get affected. So we will discuss this one by one. So first one is a disease due to the physical agent. So due to heat, burn can occur, heat exhaustion can occur. Next one is a cold. Because of cold, frost bite can be there. Next, because of the noise, there will be occupational deafness. Means because if you are working in such industries where there is so much noise is there, so that person can easily get deafness, and that can comes under the occupational diseases. Next one is a dust diseases. So if the person is working in the coal dust, so there is chances that person can get the anthracosis. Next, if there is a cotton dust, then patient will get biocinosis. Next one is a chemical exposure. If the person is working in such industries where there is so much chemicals and chemical exposure is there, so that can also cause the occupational diseases. So first one is the gases. If carbon monoxide gas is there, next one if metal is there, example lead, arsenic, so these things can also cause the occupational diseases. Next one is a biological factors, means anything bacteria, virus that is affecting to the health worker who is working in that industry, so that can cause a biological illness, that can cause a occupational disease. So example of the biological factor is the tuberculosis. Next one is a occupational cancer you can get, and last one is a occupational dermatitis. So this is the occupational diseases. Next we will discuss the prevention of the occupational diseases. So there are basically three measures that we can use, or we can help, it can get help to prevent the occupational diseases. So first one is a medical measure, second one is a engineering measure, and third one is a legislative measure. So we will discuss this one by one. So first one is a medical measure. So in this, pre-placement examination. So if new worker is there, so before placing that person into the work, we have to do the routine examination, such as we will check the blood pressure, we will just measure the height, weight, ECG, means simple things, periodic examination according to the rules and policy of the industry. We will do the pre-placement examination of that worker. Next one is a periodically health examination. So if there is a worker and who is working in such hazardous or risk causing environment, so there you can assess, or you can say to do the periodical health examination, means twice a year or twice in the month we can say, so that thing will be there. Next one is the first aid medical care. So first aid medical care must be there in the industry, that occupational health nurse must be there to give the emergency care to that worker. Next one is a notification. So if there is a spread of disease in the particular area or in the particular industry, so notification of that particular disease must be done by the industrial people to the all workers. Next one is a working environment. So where the workers are working, it should be good and it should be supportive to them, and it should be healthy, that it not causing any harm and risk to the person who is working in the industry. Next one is a health education. So we have to provide the health education to the people who is working in the community to use simple things such as a cap, mask, if they are working in such hazardous situation or risk causing situation. Next one is a maintenance of record. So we have to maintain the record of each and every person who is working in that industry. Next, we will discuss about the engineering measure, means how the arrangement of the setting or how the industry must be designed. So first one is a proper design of the factory. So proper design of the factory must be done, like proper ventilation, proper lighting must be there. Next one is a maintenance of the highest standard of general cleanliness. So cleanliness must be there in the industry. Next one is a control of the dust and fumes. So whatever the dust are coming there or fumes are there, so there must be a proper arrangement for such things in the industry. Next one is a periodical environmental survey. So environmental survey must be done by people of that industry who is authorized person. So environmental survey will be done by that authoritative person. So next we will discuss the legislation. So first one is the Indian Factory Act 1948 and second one is the Employee State Insurance Act. So this act we have already discussed. So in that various benefits are provided, as well as in the Indian Factory Act also there were so many benefits that is provided to the workers. So with the help of that we can prevent the occupational diseases. Next one is a health problem in India. So according to the country situation or according to the people of the country, there will be different types of health problem depend upon the country. So in India, we will discuss whatever the health problems are there. So every country has its own health problem depending upon the standards of living of its people, size of the population, geographical location of the country, etc. So the health problem of India may be classified as follows. So first one is a communicable disease problem. So communicable disease problem will be there in India because so many people is here, population explosion is here. So infectious disease can be easily transmitted from one person to another person, right? So communicable disease are so many communicable diseases are there. So first one is a malaria, second one is a tuberculosis, diarrheal disease and acute respiratory infection. So like that also we can say AIDS will be there, STDs will be there, and other than that we can see the hepatitis, like such infectious disease will be there in the community of people in the India. Next one is a nutritional problem. Nowadays nutritional problem become very common in India because people from the India are not getting proper nutrition, proper healthy food to eat, and because of that nutritional problem is arising such as a PEM, and because of that kwashiorkor, marasmus, such things you can observe. So protein calorie malnutrition will be there, low birth weight, because the mother is not getting proper nutrition during the period of conceiving or at the time of delivery or after the birth of baby, she is not getting proper nutrition, and because of that low birth weight is very common in India. Next one is a iodine deficiency disorder. So because of iodine deficiency there is a problem of goiter is developing in India. Next one is a environmental sanitation problem. So environmental sanitation problem is growing day by day because there is no proper safe safe water supply and drainage system in India. Next one is a medical care problem. So medical care problem is very common because the medical health care is very costly and expensive. Means it is not easily affordable and accessible to the people of community, and because of that healthcare problem is present in the India. Means there were so many hospital and clinics are present in the urban area, but still in rural area there were no hospital, no clinics is there, and to take the treatment they have to go to the urban area. So there is a discrimination that you can see in the medical care problem. Next one is a population problem. So because the people are not aware about the family planning method, and because they are not educated, and because of that population explosion is arising day by day, the population of India is increasing. So these are the problems of India, and this question I think can come in the exam for 5 marks. So this is all about the today's session. I hope you have understand. So don't forget to subscribe Ezi Nurse, because here the nursing education is made easy. Until then, bye bye and take care.